Dr. Danielle Williams, the street medicine medical director and primary care physician. We go out directly to the encampments. My specific clinic has been doing street medicine for about 4 years now. Over the past few months, we've definitely had to alter how we deliver care. We've had to shift more to outreach instead of primary care and urgent care in order to get the information out about coronavirus. So we pass out a lot of hygiene kits, hand sanitizers, a lot of food, water initially, and we do coronavirus testing.
It doesn't hurt to test, and they're giving me a free water because I'm thirsty.
Anybody home? Roots Community Health Center. Testing. Lunches, water. I've been doing it for 3 years. I see the city changing. A lot homeless now, as opposed to when I was growing up. A lot of the people that I do talk to, they familiar with my face, I'm familiar with theirs. Over time, after they see you a little bit, eventually they open up to you. Got yelled at today twice, but a month from now, we'd be bumping fists or whatever. If it wasn't for COVID, at least.
All right, you think she'll come out? On any given day, I go to 3 to 4 encampments. And we go out every Tuesday afternoon and every Thursday afternoon. And every 4 weeks, we'll go back to the same spot. So that way there's continuity and we can kind of establish a routine. In deep East Oakland. I chose this location because a lot of the homelessness in this area is very spread out. So you might see a car here, a set of tents here. I worry that sometimes they don't get enough outreach and medical attention as they need. Hello, how you doing?
I'm all right.
I've been looking for you, Leland. You're supposed to come in the clinic. What did you need?
Well, I probably need some supplies.
So you need some wound care supplies?
Yeah.
Okay. There's a lot of wound care, a lot of abscesses. In general, there's just a lot of substance abuse, a lot of mental health disorders, and then there's the things that just average adults have as well. High blood pressure, some diabetes, a lot of asthma, and it's just been challenging treating the other underlying problems that are still there despite coronavirus. We have gotten really good at getting food and water out and hygiene things to patients, and the other thing that has changed during this time is the ability to actually house people more quickly.
And I need to talk to you about housing.
Yes, are you interested in like staying in a hotel situation?
Yeah.
Okay. Well, how would you have a seat right here? Have a seat. I'm gonna go grab the paperwork, okay? Several options opened up. One were FEMA trailers and the other were various hotels. So I'm trying to take advantage of that and get at least a group of people housed while we still can. And we could get you in as early as like next week. So how do we find you? So once this is approved,
I'll be right there.
on 83rd?
Yeah.
Okay.
For these patients, a lot of times we're the only people that they really see who can help them out. So a major part of their health care is having basic needs like housing and food. So we help to connect them to those things. Anybody down here need housing? I'm doing housing referrals. Anybody need housing? I'm doing housing referrals if anybody wants housing. My name is Maggie. I'm the nurse working with Dr. Williams and the stomp team, okay? Can I have you put your mask on? Thank you.
I just got the hospital to ask.
Really? So it's even more important that you keep that mask on. You know, people can give COVID without even having symptoms. So you are at a high risk, okay?
I know.
So protect yourself.
Is it inside the house? I mean, is it inside?
It's a hotel.
Is it got water?
Yeah.
I don't care. It's
Okay.
better than right here.
Okay. Let me.
Thank you, Jim.
Okay. Let's see. Make sure I got everything. You should qualify let me do this referral for you. They're gonna call me once you're accepted, and then I'm gonna call you, and then it moves pretty quickly from there, okay? Make sure you keep that phone on you, charged, and ready next week, okay?
Yeah, it's gonna be. Thank
Okay, you're so welcome. I look forward to talking to you, okay?
you. Thank you.
Hi there, Miss Alicia. I just wanted to call you and give you some good news. You have been accepted to the Days Inn Hotel. So you can go over as soon as tomorrow. I just want to check with you. Do you need transportation to get you over to the hotel?
We're currently on Wood Street, and there's a set of people there off the main road in the area under the freeway. There's a lot of RVs, a lot of structures. They've created their own little communities within this large area where it's walled off. This is a more difficult area to get back to, so unless there's a team with capabilities to walk this area, they might not get as much services as an encampment that's right in the middle of downtown.
Hey, more food and water? More community health center!
You have like wound care stuff? In
Yeah,
case?
yeah.
Just head over to the van and they'll help you out over there.
Hold that for me with the hand. Coming to them helps so much, yet not a lot of providers will come and do it. And just keep it clean. That's the biggest thing. This is to keep it covered from anything else getting inside of it. Being able to establish rapport with the patients might help them actually do what they need to do to get housed, filling out forms, getting IDs. It's a lot of things that we might think are simple, but when you're living in this environment, it takes a lot to really process and actually complete. 180 over 115. Okay, so I'm gonna send the blood pressure medicine and the antibiotic ointment, and then we'll check back in. Yep.
I really had a lot of health problems, but I've developed hypertension out here. Like right now, I just checked my blood pressure is 180 over 115. You know, I worry about that. I used to believe in positive thinking. I used to believe there was some hope. These people that are here, they're there to help. That's all I got.
Anybody want a lunch?
There are a lot of barriers actually getting the homeless patients into the clinic, but they still need the care. If we didn't go to them, it wouldn't happen.